come from a background of spatial statistics. And I recently joined the group that works on snakebite envenoming in Hamburg. Coincidentally, the European viper is Germany's reptile of the year. So we thought, why not try and get a better understanding of its distribution and clinical impact? So the European viper covers the largest geographical region of any snake globally. It's even here if we look around close enough. And the clinical outcomes following envenomation can be severe, but there's no standardized notification system in many countries. So in a lot of places, we don't know what the distribution is, and there's no consistent management guidelines for snake bites. Louder. So to address these gaps, the first aim of this study was to describe the distribution of European viper bites in Germany. And to do this, we contacted the poison control centers that exist in the country. There are 7 in total. And we contacted them to obtain data on where the snake bites have happened between 2012 and now. And then we analyzed the data to determine what the distribution of cases are and the demographic details of snakebite victims. And secondly, we looked at 2 hospitals in Germany to collect data on the clinical presentations of snake bites and then describe that. So there's a few things that we noticed from the Poison Control Center data before I present the results. Firstly, there's a lack of standardized forms they use to collect snakebite details, or I guess any poison control center data that they collect. So because it's not standardized, the data that we collect from the different centers differs in its format. So to be able to deal with those different formats, I've really had to limit what we analyze in the data sets so it matches between the poison control centers. There's also a lot of incomplete data. So for a lot of cases, we're missing the age and sex of the patient. There's also possible repeat calls to poison control centers. So someone might call either the same center twice or call multiple centers. So we had to be able to identify those duplicates to get a clear estimate. And there's possible misreporting of snake bites. There are cases where we can see the snake was not seen. In those cases, I remove them. But there's also the possibility that there's other unconfirmed snake bites in the data. So to address one of the bigger challenges, which is the duplicates, this is just an example of the data set that we have. So from here, what we can see in orange is the identification of possible duplicates. So as I mentioned before, there's a lot of missing data. So here we're missing the age and sex of the first patient. But because it falls within a 4-day period of the 2 preceding cases, I say that that's a possible duplicate of one of those. So the criteria is that it has to be matching on sex, age, and the date of call within 4 days. For the green ones, the details are matching. We can see that it's the same sex, the same age, and the call was actually on the same day for those instances. So once I identify these duplicates, that was 116 possible duplicates and likely duplicates. And there were 36 records where the snake was not seen. So for those, I removed it so we get a very conservative estimate of the burden in Germany. So this is a summary of all the cases that we have from the Poison Control Center data in Germany. There's 736 human bites in the past 12 years. Most of those are 2 males. And the age distribution, you can see most of them are to adults. There's an almost equal split between whether it was your hand or your arm bitten or your foot or your leg. 70% of cases had local signs, which was bleeding, blistering, swelling at the bite site. And 17% had some systemic sign, which could include nausea or GI tract disruption, or some neurological symptoms. On the right side, you can see the seasonality of the bite. So there's an increase in the summer months. So this is the conservative estimate that we have for the distribution of snake bites in Germany. This just highlights that there's a lot of geographical differences. We have data from all of the centers except for Mainz, which is responsible for the 3 states surrounding it. So okay, hopefully they can hear me. So yeah, the picture on the right just shows persistent local swelling after a European viper bite up to a month after. So what can we do using this data? So firstly, poison control center data remains a largely untapped resource. So we could think about using poison control center data elsewhere. It has been done, I think, in Sweden, and I can't remember where else, but I think we should have a better idea about what the distribution of this snake is elsewhere. It would also be helpful to standardize the data collection forms that are used by the centers. That would improve the quality of data and the usability of the data. We can see from the hospital data that antibiotics, steroids, and antivenom are overused. And this just highlights the need for standardized clinical management guidelines. And just to highlight some of the other activities being done by the group, we actually work in quite a few different countries. So on the right side at the top in red is the different countries where we offer research support and where we do epidemiological surveys. And aside from the Kreuzotter, the European viper bite analysis, I'm also involved in other spatial analysis. So this is just a description. Colors might be hard to see actually at this level, of the possible distribution of one snake species in Malawi using snake observations. So it'd be interesting to look and see if this is possible elsewhere. And the QR code is to our group. With that, thank you very much.